Welcome to iPEMS, a podcast series that teaches about pediatric emergency medication safety and equips providers with strategies for quality improvement. I am your host, Dr. Tiffani Johnson of the Emergency Medical Services for Children National Resource Center. Today's topic focuses on identifying and implementing a quality improvement project. As many of you may know, the Accreditation Council for Graduate Medical Education, known as ACGME, has a requirement on practice-based learning and improvement. It states that you are required to systematically analyze practice using quality improvement methods and implement changes with the goal of practice improvement. Sharon, a pediatric resident in training, just finished meeting with her faculty advisor. She has received excellent evaluations and her procedure log is up to date. She is also right on track with her board review study plan. The one thing she hasn't done is start her ACGME required quality improvement project. Medical training can be very busy and at times quite stressful. It's hard to keep track of all of your requirements and balance this with studying, patient care, research, duty hours, and personal obligations. If you haven't started your quality improvement project, or if you're looking for ways to take it to the next level, you've come to the right place. Today I'm going to walk you through the Model for Improvement as one strategy for starting a QI project that will help you fulfill your requirements. QI projects have the added benefit of creating a safer environment for your patients and can also result in a better environment in which you can practice medicine. The first step in preparing for any QI project is to assemble a team. The team needs to be multidisciplinary for two reasons. First, if you want your project to be successful, you need buy-in from key stakeholders. Getting them involved early in the process can help achieve this. Be sure to include leaders who have the power and resources to implement the change, as well as frontline workers. Second, contrary to popular belief, physicians don't know everything. Have team members who bring different areas of expertise and different perspectives. Consider including clinical nurses, pharmacists, attending physicians, clerical staff, and family representatives. Once team members have been identified, you are ready to begin your journey on a Model for Improvement. The Model for Improvement was developed by the Associates in Process Improvement. It takes 3 fundamental questions and combines them with the plan, do, study, act cycle to drive improvement. The first question to ask your team is, what are we trying to accomplish? A general aim like we will reduce the number of medication errors in the emergency department won't get the job done. Set a specific aim. Think of something small and simple and don't bite off more than you can chew. Consider something that is a source of frustration for you when working in the ED. An example of an aim statement is, we will have at least 50% of trainees who work in the emergency department report a positive safety climate within 1 year. The second question in the improvement model is, how will we know a change is an improvement? This can be determined by developing quantitative measures. These measures should meet the SMART criteria: specific with clear definitions and standardization, measurable using quantitative terms or very clear qualitative terms, accountable, clearly defining who will ensure results are produced, results-oriented, having a meaningful outcome, and time-bound with a specific time frame. The next question that your team needs to address is what changes you need to make that will result in improvement. The Associates in Process Improvement recommend the following to generate ideas. The first exercise is critical thinking. Try to gather data and reflect on how your system currently works. As you analyze the problem, think about potential solutions. Another strategy is creative thinking. You can't expect to continue to do the same thing and get different results. Try to think outside the box and come up with new and innovative strategies to solve your problem. Benchmarking involves comparing your system to best practices. This will help you identify a goal to shoot for, as well as the opportunity to explore successful strategies by other organizations. Finally, consider change concepts to test. Some broad categories of change concepts include improving workflow, changing the safety culture, and error-proofing the system. Once you identify an aim, develop SMART measures for improvement, and come up with ideas for change, the next step is to begin your PDSA test of change cycle. The first step in this cycle is to plan. Start with a hypothesis. What do you predict will happen and why? Next, plan who, what, where, and when for your test of change and data collection. The next step in this cycle is to do. During this step, you will carry out the plan, collect data, document problems and unexpected observations, and begin analysis of the data. The next step is study. During this step, you will complete your data analysis, compare data to predictions, and summarize what was learned. Was the plan successful? If not, what went wrong? How can the plan be improved? The last step is to act. If your test was not successful, develop a new plan and repeat the PDSA cycle. If it was partially successful, make modifications and repeat the PDSA cycle. And if the plan was successful, study it on a larger scale and implement the plan. The PDSA cycle should be continuous, so you're constantly monitoring and evaluating improvement. The Model for Improvement is one strategy for developing a quality improvement project. Tune into other episodes in the iPEMS series to learn about 2 alternative methods for quality improvement. Thank you for listening to this episode of iPEMS. Now that you have listened to this podcast, you should be able to describe the Model for Improvement and use it to plan and implement your own quality improvement project in your emergency department. For more examples of quality improvement project aims, please visit the EMSC National Resource Center website. There you will also find accompanying Model for Improvement worksheets to help you get started. To learn more about medication errors in the pediatric emergency medical setting and strategies for quality improvement, please listen to other podcasts in the iPEMS series.
The iPEMS series is a production of the Emergency Medical Services for Children National Resource Center in partnership with the Alliance for Pediatric Emergency Medication Safety.